High cholesterol doesn't cause heart disease. And there is a good chance you can get off your statins, cholesterol medication. Let me explain why and how. For decades, it's been known that high cholesterol causes heart disease. Even with clear research in the last 10 to 15 years, this continues to be communicated. I can assure you, high cholesterol does not cause heart disease. It is associated with it but does not cause it. This is analogous to saying smoke causes things to be burned up. No, the fire is what causes things to burn up. The smoke is a sign that there is a fire. Just like cholesterol, smoke is a sign of heart disease. Something is getting burned. So the question is, what's the fire that causes heart disease? It's inflammation. Specifically, chronic inflammation medical terms have their roots in Latin. Interestingly, inflammation in Latin means fire. The inflammation causes damage to the heart and arteries. For millennia, humans didn't have heart disease issues. In fact, in the early 1900s, a physician could go their entire career without seeing a single heart disease or heart attack patient. That certainly wouldn't happen now. It wasn't until the 1930s that heart attacks started to become an issue. They increased more in the 1940s. And in the 1950s, it became an epidemic. And in 1955, when Dwight D. Eisenhower had a heart attack as the sitting U.S. president, the disease became front and center. Eisenhower was in the hospital for 10 days. Now all the attention was put on this new disease that was suddenly killing men and women in their 40s, 50s, and 60s. A scientist by the name of Ancel Keys hypothesized that it was due to saturated fat. Saturated fat was causing a rise in cholesterol and clogging the arteries. This started the scientific community down the path of lowering cholesterol and recommending reducing saturated fats in the diet. Unfortunately, this was a grave mistake. It was not the ultimate cause, and the given advice was also not the answer. This would lead to decades of unnecessary suffering and early deaths. Here's what happens. When the body has inflammation, and the inner linings of the heart and arteries get damaged, the body adapts to repair it. Think of standing in a small room and someone knocking a hole in the wall. It would look unsightly. So you would repair the hole, patch it, texture it, and paint it. That section of the wall would be a little bit thicker. No big deal. But imagine doing this same process every day, or multiple times a day, for 20 years. The walls of the room would slowly enclose in. Eventually, you would be standing in a tiny room and feel very claustrophobic. This is exactly what happens to the walls of arteries. Inflammation damages them. The body's adaptive repair mechanism is to produce specific types of cholesterol, more on this later, to repair the damage. 1 or 2 days, no big deal. 20 years of doing this daily, and the arteries clog. Eventually, they can clog completely and cause a heart attack. Roughly 37% of the time, the first sign of a heart attack is death. This is what was happening in the 1940s and 1950s. People were dropping dead. So what was causing the sudden rise in inflammation in the 1940s and 1950s if it wasn't saturated fat that caused it? Smoking increases the consumption of refined sugar and seed oils. It was not dietary saturated fat. Saturated fat increases good cholesterol, HDL, and lowers small, dense LDL particles. Small, dense LDL particles are the specific type of LDL associated with heart disease. Before we go further, you need to understand how total cholesterol is calculated. HDL plus LDL equals total cholesterol. If your total cholesterol is over 200, you are typically recommended to begin statins, cholesterol medication, to lower your cholesterol. They are one of the most prescribed drugs in America. But there is more to LDL. All LDL particles aren't created equal. LDL has what are called subfractions. This is the newer science that has been out for the last 10 plus years. There are 3 main LDL subfractions. 1. Big puffy LDL particles, not associated with heart disease. 2. Medium-sized LDL particles, not associated with heart disease. 3. Small dense LDL particles, associated with heart disease. When a person starts eating saturated fats and other healthy fats, the following happens. HDL increases, big puffy LDL particles increase, medium-sized LDL particles increase, and small, dense LDL particles decrease. Which is exactly what we want for heart disease. Every time my patients followed the below suggestions and went to get one of these tests afterward, here's the outcome. HDL is great, big puffy LDL is great, medium-sized LDL is great, small, dense LDL is low and great. there's no concern for heart disease. Their risk is down. We can no longer simply look at total cholesterol alone and make a recommendation for cholesterol medications. The implications of simply doing this are too grave. Here's why I say this. Cholesterol is needed for proper brain and cellular function. It's a precursor for every sex hormone in the body, and cholesterol does so much more. We can't simply block the liver's production of cholesterol with meds. We have to address the root cause of the issue, inflammation. Here's what I suggest. 1. Eliminate the most pro-inflammatory items like refined sugar, seed oils, aka vegetables oils, processed grains, and smoking. 2. Eat lots of soluble fiber, like whole, real vegetables, and whole, real fruit. 3. Focus on eating these healthy fats, like animal fats, lard, tallow, fish oil, coconut oil, olive oil, avocado oil, avocados, macadamia oil, and tree nuts. These have been consumed by humans for millennia before fats were ever demonized as unhealthy. Consider taking well-researched anti-inflammatory supplements like omega-3 essential fatty acids, vitamin D3, and turmeric, with curcumin. Quality matters, so choose reputable brands to support your health journey. Fellow health enthusiasts, it's time to shatter the cholesterol myth and focus on the real issue, chronic inflammation. By addressing inflammation through dietary changes, reducing pro-inflammatory factors, and embracing healthy fats and supplements, we can promote heart health and overall well-being. Remember, knowledge is power, so take charge of your health and live a life free from unnecessary medications. Your health is worth the effort. Stay informed and embrace the path to a healthier heart. Thanks for watching, and don't forget to subscribe to our channel for more informative videos on debunking health myths.